Shaving is another part of grooming. It is usually done each morning as an activity for most men. This should not be neglected. The caregiver is responsible for assisting the resident if they're unable to shave themselves. However, the resident, when possible, should determine the shape, the length of a beard, mustache, or sideburns. Some female residents may want to shave their legs, underarms, or any excess facial hair. Excess facial hair is not uncommon, particularly in older women, and there might be an increase in the growth or coarseness of the hair on the chin, upper lip. In those instances, tweezers may also be used to remove some of that facial hair. There are two different methods for shaving. The first is a dry method in which an electric razor is used. Less likely to cut the resident when using an electric razor. However, it may not be used when oxygen is in use with the person because of an electrical hazard. Sometimes, however, the oxygen may be removed for the period of time the resident is shaved. So please check with the nurse, however, before doing that. The skin usually is dry when the person uses an electric razor, and the razor screen always needs to be cleaned after each use. Most electric razors have a brush that comes with them, but if somehow or another it has gotten misplaced, it's perfectly all right to use a toothbrush to clean the razor screen if needed. If the razor is being shared between individuals, it must be disinfected. The razor heads themselves must be disinfected between each resident. The other type of method is a wet method. With the wet method, a safety razor is used, more likely to cut the individual. If that would occur, then sometimes you'll see use of a particular kind of pencil called a styptic pencil, or there's a brand called Nicket that might be used to stop the bleeding. Because of the possibility of nicking by use of a safety razor, you would always want to be wearing gloves. Safety razor can be a disposable kind, or it might be a reusable razor. The beard is always softened before use of a safety razor. It may be softened by use of a warm washcloth on the beard ahead of time, or it might be a lather or pre-shave lotion that's used. Guidelines for safety in shaving a resident. Use the resident's own shaving equipment whenever possible. If the resident is receiving a blood thinner called an anticoagulant medication, an electric razor may be required. OSHA, the Occupational Safety and Health Administration, requires that disposable razors may only be used once, that gloves are to be worn, and they are then to be, the disposable razor is to be disposed in a sharps container after its one-time use. Dressing and undressing a resident is another part of responsibility of grooming. Patients in a hospital generally will be wearing a hospital gown or pajamas as they're in bed a good deal of the time. In a long-term care facility, however, residents are dressed in street clothes because they're out of bed most of the day. Caregivers are responsible for helping residents dress, as well as for selecting clothing that is neat, clean, in good repair, and appropriate for the environment. The types of clothing is important because we want to select items that are easier for the resident to manage. Some examples might be a jogging suit. A jogging suit is warm and loose-fitting, which means that there aren't buttons or snaps or zippers that the resident has to deal with. Loose-fitting dresses can also help. ones that have snaps or buttons only in the front. Sometimes residents will have special clothing. These are residents frequently who are wheelchair bound, and they may have clothes that have are secured in the back and are only open in the back for ease of placing on. Offer the resident an opportunity to choose their clothing and encourage as much participation as possible. This allows for a measure of control, which is important for most all of us to feel. Select 2 or 3 appropriate items and then ask the resident, which one of these would you like to wear? Selecting only a few is better than opening up the resident's closet and having them select something from a large variety of items. Sometimes that can be too overwhelming. Remember, too, that the elderly tend to require warmer clothing due to decreased circulation, so keep that in mind when making the selection. There are some special considerations that need to be made with certain residents. Some confused individuals may disrobe, meaning taking their clothes off at inappropriate times. Sometimes putting a jumpsuit on them can help deter this from happening. Also, there may be confused individuals that expose themselves. If that were to occur, placing pants or pajama bottoms on an individual can help protect their privacy and dignity. There may be times when you will be dressing residents who either have a type of feeding tube in them or intravenous catheter or some other kind of catheters. In those instances, they may use a hospital gown that has snaps at the shoulders in order to dress and undress them more easily. Sometimes residents have what is called an affected side. An affected side means that, for an example, there might be a paralyzed right arm or leg. There might be an intravenous in that hand. It might be broken leg or arm. It might be that the person has a good deal of arthritis, making for a very painful limb.